Good afternoon, teacher.
Hi,
Yes, teacher.
good afternoon. Salome, how are you?
Fine,
Oh, I
teacher.
can see you.
It's so dark. I think here it's yeah.
Hi, now I can see you. Yeah, so I think it's a little bit hotter there.
No, it's because I just arrived at home, but I am with a big sweater and I'm hot. But
That's why.
outside it's really cold, really, really cold.
Yeah, here too. It was a strong hail just a few minutes ago, and now it's a little bit cold and darker. I don't know what happened with this weather.
I think in couple of years maybe snowing here in Latin America.
Yeah, it's so weird, but I think it would be the consequences.
Of the climate changes.
Yeah, that's right. So how are you?
I'm fine. I went today at keto for my teeth. Um, I went to the dentist. It really funny because I went for my friend of rural year, the internship that we did before we can start to work. And I went
Mhm.
a dentist and a friend dentist. He told me that I have to make four restauraciones, restoration.
Yeah,
Yeah,
that's right.
for restorations. Okay, he did one. My mom told me, no, you have the medical secure, so you have to go with that. So I went today, and they make it one restorations and limpieza, cleaning of my mouth.
Yeah, the teeth.
Yes. And after that, I went to my mom work. I was bother her and come to the home. And we are planning
Okay.
for tomorrow night.
Oh yeah, what did you do usually?
Make the meal, and after that, make a lot of games, pristiños, and talk.
Christine?
Oh, yes, you know what is pristiños?
No.
Yeah, it's a dessert of typical of Ecuador that
Mhm.
make in Quito Fest, but is usually two in the year in the last day of the year. I will show you.
Okay, very interesting. I didn't know about that.
Are these
Oh, and what is its name? Prestiños?
pristiños?
Pristiños.
Uh-huh.
Okay.
Is made with flour, harina, and they are fried, and that is really easy to make. And there is acompañado is with honey,
Uh-huh.
a honey, and that is delicious, delicious.
And yeah, we have something like that here, and we call it buñuelos.
Yes,
And
it's
yeah, it's the
all,
same.
yeah, are tasty like buñuelos. We have buñuelos
Oh,
here too.
okay. Oh, yes, it's delicious then. I know.
Yes.
Okay, let's talk about our class.
Okay.
Okay, I will put you in a situation. Okay, and can you choose at least three common conditions
Mhm.
and make a note of how patients would describe the pain in English for you? Well,
Okay.
you can tell me now.
Sorry?
You can tell me now. I was telling you that you have to make a note, but you don't have to write it down. You have to tell me.
Okay. In a situation for okay, I don't know. If a patient, masculine or 31 years old, arrived at hospital with a pain that present in the him arm, is a little the right arm at the level of the hand is with a little swimming, and it have a it looks like a green purple colored that part. The patient with the palpation, the patient referring that he feel pain, and when he extend the hand, the pain is disappearing paulatinamente.
Okay, with the time, by the time.
But the time,
Gradually.
gradually, that is the
Okay, this is the first one. And how patient would describe the pain? You can make another example of another
Yes, the most common, the patient who fall for 3 steps, arrive at emergency, and reference about a headache in the front of head and the back of head. He refers with the painful scale 1 to 10. He feel pain 9, and when he looks too much light, the pain is um, intensify with the light.
Okay. Okay, very good. Then can you make a social history of a patient, make some questions would you ask to obtain the information?
Okay, like a nurse, I am really interested about the familiar or personal history in pathologies. For example, high blood pressure. I ask diabetes, steroids, um, sometimes chirurgical um, pathologies.
Mhm.
Um, for one way. For other way, I ask about the medication, if the patient took medication for whatever pathology. In other case, if it's a woman, I ask about the obstetric history. In special, if it's not obstetric, I ask for gynecologists is if they are taking familiar planification or some pills or something like that for that.
Okay. Okay. Then can you explain your own questions about the alimentary system using the checklist condition of mouth? For example, difficulty with swallowing or indigestion, or you can choose another kind of pathology and make your own questions.
Okay. More questions. We talk a lot of diabetes, so I think is other topic. Could be about the period of the woman that is interesting
Okay.
too, because we have to ask a specific question for know something. In this case, I ask about if the period, if they are regular period, how much how much blood are in the period, how many days, if it's
Mhm.
painful or is not painful, the characteristic of the blood, uh, the color, the spessor, maybe the smell,
Mhm.
something like that. And with how they are changing with the person, the woman, to take pills or anticonceptives, because when we are taking pills or an injection, all these characteristic of the period change. I
Okay.
ask about that. What are the changes?
Okay. And in which situations do you think is essential to ask about this kind of topics specifically, or you do it with the whole patients,
Mm,
feminine patients?
not all patients, only when the patient have go with a lot painful in the period, and specific in the right flank, in el flanco derecho, the
Hmm?
right flank. Sometimes we confuse it about appendicitis, but sometimes are because they have myomas or polycystic ovarios, something kind of that. A specific one is a lot of in a quantity, a lot of blood in the periods and painful periods.
Okay, so I have an extra question, but it's related to about the notices that we already seen these days. I don't know
Mhm.
if you heard about abortion in Argentina, and
Today
I
that was
wanted to
legal.
know what do you think about that?
Okay. Uh, just yesterday, I was talking with a group of friends that are um, feminist, I think, about that topic. And like I am like a Christian is a hard topic in some case because they were refuting me a lot, and in some point they have reason, they are well in a well right, and I don't know what to say. But I think I know the adolescents are not prepared, don't be right for be mothers. That is true. And sometimes they are pregnant because they was for a victim of violence.
Violence. Yeah.
Yeah. And for this case could be maybe, but the baby there are in the bell are is exists like the moment that was the fecundation.
Mhm.
So it's really hard to know that people want to kill a, a,
A human being alive.
a baby, a creature that don't have the fault what is happening in this bad war. But in exactly, I'm not agree with legal for the abortion will be legal because no, I can't. If maybe I have the possibilities, if the person, the woman don't want the baby because I don't know violence or whatever the causes is, maybe can give for adoption. Could be
Yeah.
for adoption. And other cases are not too good, but for orphanages. But I'm not agree with that because I think when the baby born, the mother will be have the feeling of the connection with the baby. Could be, but I am really scared about that topic because that is an option for a woman that don't care about when they have relations. Uh, they don't care and maybe get pregnant and go to abort because it's legal. So I'm really scared about
Yeah.
that.
Yeah, that's right. I think the same. I don't know if they have limits to do the abortions, right? Maybe there are some cases where, well, I am not agree with any cases, but I can not do anything to about that. Just educate people and try to tell them that they have options. And maybe we have a lot of way to prepare people for these topics, but it's so hard to tell, to put an idea in that feminist people, maybe because they are so aggressive and rude, and maybe they want to fight. They don't care if you are a woman or a man. They just throw things away, like with words, right?
And that's
So
hard. That's really hard.
yeah. Okay, thank you very much, Salome. I will send to you my little questionnaire, and then, okay,
Okay.
there is.
Bye, Liz.
Hi, Salome. Hi, teacher. Good afternoon.
Good afternoon. And I hope you have a great year next year. Now it's for real.
Yes, have a good night tomorrow, Liz and teacher. Enjoy with your family, and the next year will be grateful, I think.
Yeah, I think.
Yes, thanks, Salome.
Bye,
Thank
teacher.
Bye for
you.
you.
Bye. See you next week. See you next year.
See you. Bye.
Bye. Hi, Liz.
Hi, teacher. Good afternoon.
Good afternoon. How are you?
Pretty good, teacher. Thank you. And you?
Pretty good too. But here is raining a lot. There was a strong hail just a few minutes ago, and
Really?
now it's calming down. Yeah. There, how is the weather? It's cold?
Yes, it's cold, but not raining yet.
Oh, okay. So I will put you in some situations, okay?
Mm-hmm.
And I want you to choose at least three common conditions and make like a list for me of how patients will describe the pain.
Okay.
Maybe how they go to your consultations and what did they say to you?
The most reason of the, the the most common reason that the patients go to the consultation.
Yeah, the three most common. You can
Mm,
choose anyone.
I think the first one could be fever. The most common illness, the flu. That will be the most common, the first one.
Maybe
Then
allergies.
flu.
Okay. So how do they come to your consultation, or how do they go to your consultation, and how do they say?
First of all, those patients are the most impatient and desperate.
Yeah.
They're gonna think that maybe they are gonna die, but anyway, they tell that they have some fever, maybe feel some dizzy sometimes, or can do the things with the same strong as the common day. Maybe a little cough, not always with phlegm, but the cough I think is the most common sign. And that they don't have appetite. That will be the most common sign. And well, you see maybe for how many days the patient are like this. So they describe a few days. So I think that's why I think that is a common flu.
Okay. Well, I will put you in some other situation. Okay. You have to pick one of your patients and make a social history.
Okay,
Make some questions you would ask to obtain information.
okay. Um, I think let's go suppose that we have a patient who has high blood pressure. So, well, I will ask about the age, how many old are she or he. Um, After that, um, why she is coming to our consultation, or maybe what can I do for her or him. Um, then I will ask the symptoms and signs that the patient has been present about all these days or months. I don't know, depends of the case. After the signs and
Mhm.
symptoms, I will ask about family history, maybe her parent or her parents have any disease, or maybe has a high blood pressure too. Maybe the brothers and aunts, if they have some illness too. Mm, well, this is history, family history. In personal, I think if she or he has another disease, if she or he smoke, drink any kind of alcohol, consume drugs, if take some pills, and what pills, and the doses, and how many times per day.
Mhm.
Um, if she or he has any surgery, maybe that could be important. And if the patient is woman, I will ask about the pregnancy, how was it, and all about that. After that, personal, family. Then I think I will make the physical exam, take
Mhm.
the signal vitals, the vital signals, and then I try to discover the reason about the disease, or that, or what is annoying the patient.
Okay. Okay. So after that, if you choose an illness or a condition, can you explain your own questions about, for example, alimentary system using the a checklist of conditions like difficulty of swallowing or indigestion? This is an example, but you can use for
Mhm.
another illness, and you can make a checklist of signs and symptoms that these patients maybe they have, no, right?
If we continue with the same patient that has high blood pressure, I think nutrition habits will be important. I forgot it. So I think what the what she eat, if she eat fruit, vegetables, only pork maybe, or beer. Um, and I will ask about the specific illness, if she or he has feel headaches, maybe um, chest pain, if she or he have has feeling numb, maybe dizzy sometimes,
Mm-hmm.
maybe when eat, after that experiment some dizzy, or uh, blur, ¿cómo es? Visión borrosa, vision blur, I think,
Yeah, blur
blur
vision.
vision. I think that those could be the most common signs of high blood pressure.
Okay, that was pretty good. And I have an extra question, but it's related to recently maybe notices that we have on Facebook or some international things that has happened yet. Okay, maybe you heard about Argentina and the legalization of abortion, and
Yes.
I want to know your opinion.
Mm, if you ask me as a doctor, I will say no. More or less like euthanasia, more or less like this.
Okay.
As a doctor, I think I could not participate in that. I am not agree with that. I grew in a religion house, and that teach me that the life, the scientific discuss when really the life starts,
Mm-hmm.
but in religion, it starts at the moment zero. And I think I could not do that. Definitely, if someone asks me to do that, I think I will say no. But
Okay.
personally, some situations are really, really difficult, and maybe when you are not in that position, maybe you can juzgar, you
Judge.
judge, and maybe try to give an opinion when you are through that situation. Maybe a case of in some violaciones,
Uh, Violations
violation or sexual violation. I
or
think
sexual assault.
okay. I think the person they will feel terrible, and I don't think that she wants to have that baby. But I don't know. This is a personal view, but medical in the medical view or the medical point of view, I will say definitely no.
Okay. So, as a doctor, which might be the way to explain this to people? Maybe if you're discussing with feminists and you have to give your point of view, and you know that they are rude and really really tough people to treat with, so how
Mhm.
would you do it?
Like change your mind.
Not changing her mind, because I think we cannot do that. We don't have that that kind of it's not easy, right? But maybe explain your position in a way that they can understand, they can assume, but of course they won't share with your opinion, right? But they will
Mhm.
be maybe consider or something like that.
But the speech with the patient or with someone who are making those rules.
Your position as a doctor.
Mm, well, I think I will say the same thing that I told you about religion. I think that is important, but I don't know if all the people understand that because actually no, not everybody believes in God. I will say that we have to respect the life. It doesn't matter what the way that it was created, and we don't the fact to be doctors, uh, does fact don't make us gods or make someone that we can decide when give or quit the life.
Okay.
Mm.
Yeah, because I have a point here. Some people told me once that this is a problem of public health,
Mhm,
right? It's not a moral problem, it's a
mhm.
problem of public health. And I was telling them that, of course, it's a problem of public health. That's why we have to give education to our people, not to give the just a way to maybe have some travels in the future. Maybe you are making an abortion today, but tomorrow you will be punishing yourself about that decision that
Exactly.
you made before, right? And they don't
Yes,
know, they don't understand, and they don't make people understand either what are the consequences of that decision. And
exactly. I think I have seen some scientific studies, and the case of depression after
yeah,
the person did that are terrible. So I think that could be another way that maybe you are not you don't know what are you doing, think better. And yes, I think about abortion is not because all the cases are about some violence. Maybe it's because the people are very, very irresponsible and only have sex without protection. And I will say, okay, if you want to have sex, use some protection, and then you won't have the problem that you have a baby that you want. So I think
Right.
exists a lot of reasons to that the people want that, but trying with each reason, work with each reason little by little, I think we try to make understand the people.
Yeah, that's right. Okay, I agree with you. Thank you, Liz. Okay, I
Thank
will
you.
send to you my little questionnaire, please. I don't know if you can see it. I think
Now
yes.
I can see it. Okay, teacher.
Okay, I will take a picture and that's right. Okay, Liz, thank you very much. I hope you have a great night with your family and you meet your goals next year.
Yeah, see you the next year.
Now for real.
Happier. No, it's real. Thank you
Yeah.
so much,
Have
teacher. What?
See you, Liz. Thank you.
Bye,
Bye.
teacher. Happy New Year.
Happy New Year.